For my presentation, I will be talking about the Ebola virus. Ebola is an enveloped RNA virus in the Floridariidae family that presents in a long filament shape. The 5 different species which fall under the Ebola genus are Bundibugyo, Sudan, Thai forest, Zaire, and Renton Ebola virus. Ebola virus is transmitted from person to person via fluid exchange. The highest cases are caused by people encountering bodily fluids of a deceased victim, or through healthcare exposure. The most effective way of preventing transmission, as recommended by the CDC, is to bury the deceased as soon as possible, and to take the proper precautions when caring for someone with Ebola virus. Transmission has proven to be unaffected by travel bans and is discouraged by the WHO as it isolates people from experienced aid and necessary equipment. Ebola virus occurs from zoonotic sources and has been observed in monkeys. Additionally, some zookeepers and handlers tested positive for Ebola virus antibodies without ever actually contracting the virus. This strain of Ebola is Renton, which humans are not susceptible to. The current zoonotic sources of Ebola virus strains are expressed by humans, unknown, and there is no vaccine. The first symptoms characteristic of Ebola virus exposure are fever, body pains, fatigue, emesis, diarrhea, and unexplained bleeding. However, in the late stages of Ebola virus, patients may experience rash, hiccups, and a red coloring of the sclera. Typically, there is an incubation period of 8 to 10 days, though symptoms can appear as soon as 2 days after exposure. Since Ebola virus is relatively rare and highly contagious, it is typically seen in sporadic outbreaks. Outbreaks in the past and ongoing outbreaks occur in West Africa, with notably higher frequency in Sierra Leone, Liberia, Guinea, and the Democratic Republic of the Congo. The largest Ebola virus outbreak occurred in West Africa from 2014 to 2016, with 28,700 reported cases and an estimated 11,300 deaths. Ebola virus has an extremely high mortality rate, with an average of roughly 50% and observed as high as 90% in some outbreaks. Young children are highly susceptible to Ebola virus, with 97% of children aged 2 to 4 testing positive for the virus when exposed, whereas a typical adult has a less than 60% contraction rate. Consequently, young children are among the main mortality group and tend to express harsher symptoms. The common laboratory methods used to diagnose Ebola virus include EBOV antigen testing, blood analysis, and semen testing for antibodies. The image shown in this slide is an example of an EBOV test. All of these target finding antigens and antibodies to determine whether you have the virus or not. Currently, there is no cure or vaccine for human Ebola virus. The only treatment recognized by the WHO and CDC is supportive care, including symptomatic treatments such as antidiuretic medications, administering fluids, and blood transfusions. Infection does grant long-lasting immunity in the body. However, in some cases, with male survivors, they can spread the Ebola virus as carriers through their semen. Due to the nature of academic knowledge on Ebola virus, it is unknown if this immunity is entirely permanent. In 2018, the WHO launched a study in the Democratic Republic of the Congo comparing the efficiency of 3 trial drugs. The results of this test reveal promise for a possible cure soon, as 2 of the 3 drugs increase patient survival rate. These drugs are MA11-4 and REGN-EB3. They can bind to Ebola virus virion receptors, essentially blocking their contact with human cells. Here is a list of the sources that I used for this presentation.